All right, let's talk about something that can feel like a total black box, our gut. Today, we're going to pull back the curtain and demystify the whole world of GI diagnostics. We're going on a journey to see how doctors turn those mysterious symptoms into clear-cut answers.
I mean, who hasn't, right? Our bodies send us these weird signals sometimes, and we're left guessing what it all means. Well, that's exactly where our investigation kicks off today. It might feel like a mystery, but we've got some amazing tools to solve it. So let's dive in.
So first things first, why would a doctor even suggest we need to take a look inside? Well, it almost always starts with symptoms. Those little, or sometimes big, alarms your body is sounding, telling you that something needs a closer look. Let's talk about what those alarms usually are.
Think of these as the first clues in our detective story. That nagging abdominal pain that just won't go away, sudden changes in your bathroom habits that last for weeks, or maybe some unexpected weight loss. These are the signals that make a doctor say, okay, it's time to gather some more evidence.
So how do we actually gather that evidence? This is where we get to the really cool part, the detective phase. Doctors have this whole diagnostic toolkit just filled with specialized gear designed to investigate all those clues.
And honestly, this is the best way to think about it. This isn't just a list of scary medical procedures, it's a fact-finding mission. Each test, each tool, is designed to get us one step closer to solving the case of what's causing your symptoms.
And that toolkit is basically organized into three main categories. You've got your lab tests, which are kind of like doing the background research. Then you have scope procedures, which is like sending in a detective for an inside look. And finally, imaging studies, like CT scans, which give us a different kind of map from the outside.
Lab tests are usually the first step. They're totally non-invasive. A simple stool sample can find hidden bleeding you'd never see, or a blood test can check on your liver. It's all about gathering that initial intelligence without having to go inside just yet. But when you really need to see what's happening at the scene, you bring in the specialist. And that's where scope procedures come in. We're talking about a tiny camera on a flexible tube, giving your doctor a live, direct feed from inside your GI tract. This is where we get the hard facts. And that brings us to one of the most powerful tools in the entire kit. To really understand how this works, we're going to follow that camera on its most common and arguably most important journey, the colonoscopy. So what is it exactly? Well, a colonoscopy is pretty much the gold standard for checking out the entire large intestine. That little camera on a tube, called a colonoscope, travels all the way through your colon, giving your doctor a complete high-definition tour. Now, here's what makes this thing so incredible. It's not just for looking, it's for doing. A doctor can diagnose what's causing your symptoms, yeah, but they can also spot and remove precancerous growths called polyps right then and there. It's an investigation and an intervention all in one shot. Now, the whole thing can feel like a big deal, but you can really break it down into 3 stages. First up is the prep. Let's be real, everyone says this is the toughest part, but cleaning out the colon is absolutely crucial so the camera can get a crystal clear view. Then there's the procedure itself, which is usually super quick. And finally, the discovery, where your doctor gets the answers.
So just how important is this? Well, get this. The American Cancer Society recommends that average-risk adults get a screening colonoscopy every 10 years. That fact alone tells you just how incredibly effective this thing is. It's a true pillar of cancer prevention.
Okay, let's switch gears and get practical. Knowing what to expect before you go in and what's normal afterward can make the entire experience feel way less intimidating. So before you go, that clear liquid diet is key. Again, it's all about giving the camera a clear path. You'll also have to avoid things like aspirin, because if a polyp is removed, you don't want any extra risk of bleeding. And here's a pro tip everyone shares. Chill the cleansing solution. It really does make it easier to drink. Afterwards, feeling gassy and bloated is 100% normal. You might see a little bit of bleeding too, especially if they took a tissue sample. And the biggest rule, you absolutely have to have a ride home. The sedation means no driving for at least 24 hours, so plan on a lazy day. Now we have to talk about risks. With any medical procedure, there are some. But this isn't to scare you. It's about being informed and being an empowered patient. Let's be super clear here. Serious complications from a colonoscopy are rare, very rare. But noting what to watch for afterwards is just plain smart. Being informed is what helps keep you safe. The two main risks to know about are significant bleeding or a hemorrhage and a tear in the colon wall, called a perforation. If you start to feel really dizzy or your skin gets cool and clammy, that could be a sign of bleeding. If you get hit with severe pain in your abdomen and a fever, that could be a perforation. If you experience either of these, you call your doctor immediately. It's just about knowing the warning signs. So after all of it, the prep, the procedure, understanding the risks, we finally get to the whole point of this journey. We arrive at the payoff, the power of knowing.
And that's really the bottom line. These diagnostic tools take all that worry, all that uncertainty that comes with strange symptoms, and they transform it into solid, concrete answers. It's about putting the power that comes with knowledge back into your hands.
I think this sums it all up perfectly. The real win isn't just getting the test over with. The true benefit is that feeling you get afterward, either the relief that everything's okay or the life-saving advantage of early detection. It's all about securing your peace of mind. So I'll just leave you with this question to chew on. Could a procedure that takes maybe 20 minutes of your time actually buy you years and years of peace of mind? When you weigh a little inconvenience against that long-term benefit, the answer becomes pretty clear. Thanks for joining me on this explainer.